Hello. In the previous session, we had dealt with the maxillary premolars. We completed the maxillary first premolar as well as the maxillary second premolar. We are now ready to go down to the mandibular area where we shall deal with the mandibular first premolar and the mandibular second premolar. In this session, we are going to deal with the mandibular first premolar. As a review of the distinguishing characteristics of premolars, let us focus on a few important points. The mandibular first premolar is much smaller than the mandibular second premolar. More importantly, the mandibular first premolar will exhibit lesser variations when compared to the mandibular second premolar. The mandibular premolars, buccolingual and mesiodistal width are almost equal to each other, which is not the case with the maxillary premolars. When viewed from the proximal, the mandibular premolar's crown profile will tilt to the lingual. This is due to the lingual tilting of the residual alveolar ridge that is present. The two mandibular premolars do not resemble each other nearly as much as their maxillary counterparts. They are also transitional teeth, which help in transitioning from the anterior segment to the posterior segment along with the canine. Coming to the first premolar, let us look at a few general characteristics. In the arch view, from the midline, the mandibular premolars are given the number 4. They are the fourth tooth in the oral cavity, especially in the mandibular region. In the third quadrant, we call the tooth 3-4. In the fourth quadrant, we call it 4-4. Therefore, the first mandibular premolar have the numbers 3-4 and 4-4. When we come to the universal system, the right first premolar is given the number 28 and the left first premolar is given the number 21. Now that we have understood this, we should also be clear that this is also a succedaneous tooth and this replaces the deciduous first molar. The general form and function, we have to know that the two cusps are present, a buccal cusp and a lingual cusp, but the buccal cusp comes into more prominence because it is the functional cusp of the two. From the occlusal aspect, you will be able to understand that it has a diamond shape which closely resembles that of the canine. From either the facial or the lingual aspect, sometimes you will be able to appreciate the pentagonal form that is present. Therefore, in the facial and the lingual surface, you will see pentagonal form. In the mesial and the distal, you will be seeing rhomboidal forms. And at the level of the occlusal, you will see a diamond shape. Now we come down to the developmental table. Here, initiation of calcification occurs between 1 and 3/4 to 2 years, followed by which enamel is completed at 5 to 6 years. After the 10th year, which means in between 10 to 11 years, the first premolar in the mandible will erupt, followed by 12 to 13 years where the root shall complete its growth. Therefore, initiation of calcification occurs between 1 and 3/4 to 2 years. The completion of the enamel will occur between 5 to 6 years. The eruption will happen between 10 to 11 years, and completion of the root will occur between 12 to 13 years. Now that we are done with the developmental table, we shall now proceed towards the buccal aspect of the mandibular first premolar. So, in the buccal aspect, you will be able to appreciate the pentagonal outline that I had told you earlier. It is similar to what we saw earlier in the canine as well as the second premolar. The buccal surface that you will see is going to be convex. As you can appreciate what I'm drawing, the buccal surface is convex, and this also mimics the facial form of the canine as well as the second premolar. It is more convex occlusogingivally rather than mesiodistally. So the occlusogingival convexity will trump the mesiodistal convexity. So you will now be able to appreciate the crown being much more rounded in the buccal aspect coming forward from the occlusogingival direction. We now proceed to the lateral margins of the tooth. Coming to the mesial margin, you will find that the mesial margin is slightly concave, just slightly concave, and the height of contour will be at the middle area. It will slope again as a convexity as we go downwards, getting a rounded mesio-incisal angle. It is rounded when compared to the second premolar. The distal margin is similar to the mesial margin, and it is also convex. You get a rounded disto-incisal angle. What is to be noted is that the distal slope is longer than the mesial slope. The distal slope is longer than the mesial slope, which means that if I draw the long axis of the tooth, the cusp tip is a little offset when it comes to the mesial side. The cervical outline is slightly evenly convex and the curve is gradual towards the apex. The depth of curvature is going to be less than that what we see in the anterior teeth. When you look at the occlusal orientation, you will notice that there is a buccal cusp tip, the buccal cusp tip. And when you see this, the buccal cusp tip will divide it into two occlusal portions. You have the mesio-occlusal portion as well as the disto-occlusal portion. So you will have a mesio-occlusal portion and a disto-occlusal portion leading to the formation of a mesio-occlusal slope and a disto-occlusal slope, and according to the skew you will be noticing that the disto-occlusal slope will be longer than the mesio-occlusal slope. In other considerations, we have to note the presence of a buccal ridge. Buccal ridge, and the buccal ridge is a representation of the mid-buccal lobe that is present. The buccal ridge is more prominent, and you will see on the right and on the left, you are going to see mesiobuccal developmental depression and a distobuccal developmental depression. So from the buccal ridge you are going to see a concavity extending to the mesial called the mesiobuccal developmental depression, and to the distal of the buccal ridge you will find the distobuccal developmental depression. Imbrication lines are not usually seen in the mandibular first premolar. The buccal height of contour will occur at the cervical third. The buccal height of contour will occur at the cervical third. So, I hope you have understood the buccal outline, buccal surface of the mandibular first premolar. Let us repeat what we have learned. The mesial surface initially will be concave, followed by a convexity. The distal outline is going to be much more rounded, leading to two rounded mesio-incisal angle and a disto-incisal angle. The cusp tip is skewed slightly towards the mesial, which means the mesio-occlusal slope is lesser than the disto-occlusal slope. The cervical area will be curved towards the apex and it is shallow when compared with the anterior tooth. When you take a line along the long axis of the tooth, you will notice that the cusp tip is skewed towards the mesial. Also, the height of contour will be at the cervical third. You find the buccal cusp ridge that is present, and lateral to it on the mesial side you have the mesiobuccal developmental depression and the distobuccal developmental depression. I hope you're clear with the buccal aspect of the mandibular first premolar. We now move to the lingual aspect of the mandibular first premolar. The lingual aspect lacks the prominent occlusocervical ridge that you saw on the facial, and you will be able to appreciate that both sides are consistently convex. Consistently convex. You are also able to appreciate that most of the occlusal table or the occlusal surface is visible from the lingual aspect. This is because of the small lingual cusp that is present. This the what I've marked in green is the lingual cusp, and the lingual cusp is small. Because of that, you see much more of the buccal area as well as the occlusal table. All lingual dimensions will generally be lesser than that of the buccal surface. Also, you are going to see lingual convergence. See, you have lingual convergence on both the mesial and distal area. This allows you to see a brief view of the mesial surface running over here and the distal surface running towards the lateral end. This is because of the shortened lingual cusp that is present. So you have an evenly convex mesial, evenly convex distal surface, a slightly rounded buccal cusp which is viewed from here because of the presence of a small lingual cusp. Most of the occlusal table is also going to be visible from this aspect. Also, you are going to see a lingual convergence that is present. Also, the mesiodistal width of the first premolar in the lingual aspect is much lesser when you compare to the mesiodistal width on the buccal aspect. The mesial and distal margins are going to be as similar as the buccal surface, but they will be much shorter because the lingual surface itself is considered to be short. The cervical outline is slightly convex and it is convex towards the apical portion of the root. Yes. Finally, we come to the occlusal outline. If you look at the occlusal outline, you will see the almost small, sharp lingual cusp that is present. Remember, the cusp may be small, but the cusp can be sharp. The disto-occlusal slope, if you look at the disto-occlusal slope, that is going to be slightly longer than the mesio-occlusal slope. Once more, the disto-occlusal slope will be longer when you compare it to the mesio-occlusal slope. I hope this is clear for all of you. Also, the cusp tip that is present will be slightly offset to the mesial. You see the lingual cusp tip? The lingual cusp tip is going to be offset towards the mesial. I hope this is clear for you. Also, you will be able to appreciate the presence of a transverse ridge on either side. See, you will be able to note the presence of a transverse ridge on both sides which are available from the lingual aspect because the occlusal table is visible. The lingual height of contour will be located at the middle third. Sometimes, if you are lucky, you will be able to view the mesiolingual developmental groove. You will be able to view the mesiolingual developmental groove, which ends up in the mesial pit, and this can be also viewed from the lingual aspect. I hope you're clear regarding the lingual aspect of the mandibular first premolar. Coming on to the mesial aspect. Here you will be able to visualize that the crown is going to be roughly rhomboidal in shape. Although this is a little bit difficult to visualize because the lingual margin is short. It is rhomboidal in shape. Coming towards the buccal margin, the buccal outline is going to be generally convex. Yes, and the height of contour will be at the gingival third. The lingual margin is going to be convex but lesser when compared to the buccal margin, and the crest of curvature will be close to the occlusal third of the lingual portion. The margin itself is so short, therefore it might be confused with the middle third of the crown. The cervical will be slightly curved towards the occlusal surface. The occlusal outline reveals that the buccal portion of the transverse ridge will be sloping at an angle, and that angle is approximately 45 degrees, and this is paralleled by the mesial marginal ridge. So you can see a parallel mesial marginal ridge that is coming. Therefore, the buccal portion of the transverse ridge is going to be visible, and that is paralleled by the mesial marginal ridge. The angulation that it is causing is 45 degrees. Since the crown profile of the tooth is angled towards the lingual, you are going to see that the buccal cusp tip is almost centered over the root. See, the buccal cusp tip is almost centered over the root. Yes, it is almost centered over the root. The contact area that is present will also be present on the buccal area. Oh, and it's an ovoid portion that is seen on the middle third of the root. The height of contour is also here at the middle third of the root. What is essential to understand is both areas are convex. The labial is convex and the lingual is convex but relatively straighter when compared to the buccal surface. The transverse groove, marginal ridge are all going to be parallel to each other, and they elicit a 45-degree angle. The height of contour and the will be at the level of the gingival third. The contact area will be in the middle third. Now that we have cleared out the mesial aspect, we are ready to get into the distal aspect of the tooth. The basic outline of the anatomy of the tooth is similar to that of your mesial surface. There is no distal developmental groove. There is definitely going to be a distal marginal groove. There is no distal developmental groove, but you will see a distal marginal groove. The distal surface is a little shorter occlusocervically when compared to the second premolar. The cervical line curvature is also going to be lesser when it is present. The contact area is still at the middle third because this is going to contact the second premolar. The distal marginal ridge also doesn't show as steep a slope as you compare to the mesial marginal ridge. Finally, we come down to the occlusal aspect of the tooth. The occlusal aspect of the tooth. When you look at the crown, it is going to be roughly rhomboidal in shape. Roughly rhomboidal in shape. In some cases, they are even considered to be written as diamond in shape. You are going to see a pentagonal diamond outline as well. Due to the mesial offset that is present, the cusp tip is going to be larger that is present. The distal side will obviously be larger than compared to the mesial side because of the offsetting of the two cuspal tips. Now let us come down to each of the outlines that we are going to draw. The first one is the buccal. The buccal portion is uniformly convex and well described, and this buccal ridge, the buccal ridge is very well developed over here. The lingual margin is also much more prominently convex, but the length of the lingual is much lesser than that of the buccal outline. If you look at the mesial outline, the mesial is going to be slightly convex. It is going to be slightly convex, and the only exception is that if you look at this area, you will see a slight concavity that is present. You are going to see a slight concavity that is present near the mesiolingual line angle. If you look at the distal outline is way more regularly convex when compared to the mesial outline. Now, if you look at the boundaries, you have a distal marginal ridge, a distal marginal ridge and a mesial marginal ridge, which are both encompassed by the buccal ridge as well as the lingual ridge. This is a part of the occlusal surface or the occlusal table of the mandibular first premolar. Let us now come to the components of the occlusal surface. Usually you are going to see two cusps. The first cusp is the buccal cusp. The second cusp is the lingual cusp. The buccal cusp is slightly offset towards the mesial. The buccal cusp is slightly offset towards the mesial. Therefore, why is it so? Because the crown is inclined lingually. The crown of the mandibular first premolar is inclined towards the lingual side. Therefore, the buccal cusp appears to be offset more towards the mesial surface. Like I told you with the maxillary, you are now going to see four inclined planes. You are going to see four inclined planes with this cusp. So you have the mesio-buccal inclined plane, disto-buccal inclined plane. You also see the mesiolingual inclined plane and the distolingual inclined plane. So all of these are going to have a three-dimensional projection, and now with this you will be able to appreciate the buccal cusp that is present. So four inclined planes are present: the mesio-buccal inclined plane, disto-buccal inclined plane, mesiolingual inclined plane, distolingual inclined plane, and what is important is all four inclined planes are fully functional. They are fully functional. Now that we have dealt with the buccal cusp, it is now time to turn our focus to the lingual cusp. The lingual cusp is usually pretty small, and it is no more than half the height of the buccal cusp. Yes, so like the buccal cusp, the lingual cusp is also offset towards the mesial. The lingual cusp, like the buccal, is also offset towards the mesial. Why? because the crown is lingually tilted. Similar to earlier forms, you are now going to find all the inclined planes that are present. So you have the mesiolingual inclined plane, you are going to have the distolingual inclined plane, the distobuccal inclined plane. Also, you have the mesiolingual inclined plane and the distolingual inclined plane, all leading to the formation of a lingual cusp. So now I'm going to draw all of these inclined planes together. So let us go one more time. You have the mesiobuccal inclined plane over here. You have the distobuccal inclined plane coming in like this. You have the mesiolingual inclined plane coming in like this, and the distolingual inclined plane coming, leading to the formation of a large buccal cusp which is offset to the mesial. Similarly, let us also draw the others. You have the mesiobuccal inclined plane, the distobuccal inclined plane, the mesiolingual inclined plane, and the distolingual inclined plane, leading to the formation of a lingual cusp which is going to be short, and again as usual it is going to be offset towards the mesial. I hope you have understood the three-dimensional functional inclined planes of the mandibular first premolar. Now we are going to go down to the marginal ridges. You are going to see a mesial marginal ridge. You are also going to see a distal marginal ridge, and these angulations will be at 45 degrees to each other. The distal marginal ridge is going to be much more longer than the mesial marginal ridge because the mesial exhibits a concavity, therefore you have a interruption that is present. When you come to the pits and the fossa that are present, obviously you are going to see the mesial pit. In the distal, you are going to see the distal pit, and in between these two you are going to see the central groove. So here you have been able to appreciate the mesial pit, here you are able to appreciate the distal pit, and over here you are appreciating the central groove which extends between the mesial as well as the distal pit. Similarly, you are also going to note the mesiobuccal triangular groove. You have the mesiobuccal triangular groove and the distobuccal triangular groove. The distobuccal triangular groove. You will then be able to see a mesial triangular fossa and a distal triangular fossa. If you divide it into two, here is the mesiobuccal triangular fossa, distobuccal triangular fossa. This is the mesiolingual triangular fossa. This is the distobuccal triangular fossa and the distolingual triangular fossa. So now we can appreciate all the areas of the occlusal region of the mandibular first premolar. So before we get into the entire aspect, let us just revise the important portions that can be asked during the examinations. So you have the presence of the distal pit and the mesial pit. Yes, you are able to appreciate the distal pit as well as the mesial pit over here. So in relation to the distal, we are going for the distal pit. So here you have the central groove. Yes, you have the distal marginal groove. You have the distal triangular groove, which is the disto-buccal triangular groove, and the disto-lingual triangular groove, all forming the distal pit. Also, you are going to have the disto-buccal triangular fossa and the disto-lingual triangular fossa. Repeating with the other side, you have the mesial pit, which is formed by the central groove, the mesio-buccal triangular groove, disto-buccal triangular groove, and the distal marginal groove that is present over here, all forming the distal pit. You will also be able to appreciate the mesio-buccal triangular fossa and the mesio-lingual triangular fossa with this. I hope the occlusal characteristics of the mandibular premolar are clear to you. It's a little complicated, but if you use a diagram properly and read the textbook, you will be able to appreciate all aspects of the premolar once you are able to understand the shape and structure of the occlusal surface. Finally, we come to the root. The root is normally single. It is a fairly straight root, and the outline will taper as you go towards the apex. The outline tapers as you go towards the apex. The root length is slightly smaller than the mandibular second premolar, and it is found to converge. Root concavities may be seen, but these concavities occur only slightly in some people only. Finally, we come to the variations and the anomalies that can be exhibited by these teeth. First one is the absence of the mesiolingual developmental groove. In some conditions, the mesiolingual developmental groove can be completely not present in the mandibular first premolar, or you might be able to see two parallel mesiolingual developmental groove. Either there will be a complete absence of the mesiolingual developmental groove, or two parallel mesiolingual developmental grooves may be present. The size of the lingual cusp is another entity. The lingual cusp may be completely absent in certain premolars, or they may be as large as the buccal cusp. The continuity of the transverse ridges can also be differentiated, and it is affected by the depth of the central groove that is present. The location of the lingual cusp is also contentional. As I told you, it is mesially offset, but sometimes you might find that the cusp will be centered or offset towards the distal. Depends on how inclined your tooth is. So, the last difference that you can see is the bifurcation. Usually, like I told you, it is going to be a single rooted structure, but sometimes you will be able to be appreciating a bifurcation, and you will see a skyfurcation that is present over here, dividing it into two buccal and lingual roots respectively. Here you will also appreciate the presence of a buccal root canal as well as a lingual root canal. Even when you have a single root canal, rooted tooth, you will be able to appreciate two root canals. Therefore, endodontic therapy failures can occur because of lack of identification of these canals. I hope you have understood the mandibular first premolar completely. We shall move on to the mandibular second premolar in the next session. Thank you.